Hi everyone. This semester I've been working on the research question, how COVID-19 has exacerbated the mental health and well-being of temporary migrant workers in Canada. So some key findings. To start, there's limited research on migrant workers, and the review of current literature identified that temporary migrant workers have been dramatically impacted by COVID-19 as the pandemic has exacerbated underlying problems that contribute to poor mental health. More specifically, COVID-19 exposed existing vulnerabilities and barriers that temporary migrant workers face. Findings from the literature review showed how COVID-19 has perpetuated racism and inequality, and this has contributed to the increased fear and anxiety within these communities. This has also led to poor emotional, social, occupational, and physical well-being. In addition, migrant workers continue to work in environments that are unsafe and below public health standards. These workplaces are not taking appropriate measures to stop the spread of COVID-19, and temporary migrant workers are at a higher risk of contracting the virus. The results identified that exclusionary policies that previously denied temporary migrant workers public-funded healthcare and income support have created significant barriers when it comes to accessing healthcare services. Advocacy groups have been working to shed light on the working conditions and on the barriers that migrant workers face when accessing these services. So some policy implications, the complexities of accessing healthcare services as the migrant worker has deterred many from using services when needed. Therefore, interventions aimed at providing temporary migrant workers with resources and knowledge on healthcare access is necessary. More specifically, information and resources on these services can be sent out to migrant workers through audio recorded messages in preferred languages or through WhatsApp. This will also guarantee that migrant workers have access to healthcare coverage regardless of their status. In addition to this, the results also identified how the working and living conditions for migrant workers are subpar, and this has contributed to poor mental health outcomes. To stop the spread of COVID-19 in living conditions, the federal government can work with provincial governments and health experts to provide alternative housing that can be used by workers to isolate if positive for the virus. Employers should also be given explicit instructions to follow when an outbreak occurs to ensure that migrant workers are supported and also to contain the virus. Educational policies will be needed to reduce the stigma and discrimination that migrant workers currently face. More specifically, the federal government can start public conversation that dismisses xenophobic myths about how COVID-19 is transmitted. And the government can also partner with support organizations to ensure that migrant workers have access to social workers and culturally appropriate support. So in conclusion, there's limited research on this topic, and this made it challenging to understand and analyze the extent to which migrant workers' mental health has deteriorated. More evidence-based research is needed to understand the complexities of mental health outcomes for temporary migrant workers. Research in academia and government policies also need to be more inclusive and culturally appropriate in order to protect the vulnerabilities of migrant workers. Migrant workers contribute to all sectors of the economy, and excluding them from these policies only perpetuates vulnerability and inequality.